I'm Andreas Hamberger, and this is the Hamberger Report, where I cover AI governance, enterprise architecture, and the technology decisions that actually matter to the people who have to make them. If you find this useful, subscribe and hit the like button. It helps more professionals find the channel. Now let's get into it. "60% of New Zealand's aged care facilities lost access to their medication management systems on the 22nd of February 2026. Not for an hour, for more than 6 days, nurses and caregivers reverted to paper records to manage drug rounds, track prescriptions, and ensure that some of New Zealand's most vulnerable residents received the right medication at the right time. The cause was not a hardware failure. An attacker gained access to the MediMap platform and deliberately falsified patient records, changing names, dates of birth, allergy information, and resident status. Living patients were marked as deceased. I'm Andreas Hamberger. This is the Hamberger Report, where I cover cybersecurity explained for the people who sit around the board table. 6 days after the MediMap breach, the Department of the Prime Minister and Cabinet published New Zealand's Cybersecurity Strategy 2026 to 2030. The timing reflects the environment in which the strategy arrived. 3 major health platform breaches in 7 months, a national cybersecurity center recording 1,249 incidents in Q3 2025 alone, and an Office of the Privacy Commissioner that has recorded a 43% increase in notified breaches in its 2024 to 25 annual report. The strategy carries 4 objectives: understand, prevent and prepare, respond and partner. The governance implications for directors sit in 2 provisions of the accompanying action plan. First, the action plan tasks the Ministry of Justice with providing advice on options for a civil pecuniary penalty regime under the Privacy Act 2020. Currently, New Zealand's maximum penalty for failing to notify the Privacy Commissioner of a serious breach is $10,000. There are no financial penalties for failing to protect personal data in the first place. The action plan signals this will change. Second, the action plan proposes a new criminal offense for people who view, possess, or disseminate personal information knowing it was illegally obtained. Downstream exploitation of breached data, not just the breach itself, becomes a criminal matter. This is the once only moment. The moment when the window for building resilience before the breach is still open, but visibly closing. To understand what is at stake, you need to understand where penalties currently sit. Australia's Privacy Act permits penalties of up to AUD 50 million, 3 times the benefit obtained from a breach, or 30% of annual turnover, whichever is greater, per contravention. The European Union's GDPR permits fines of up to 4% of global annual turnover. New Zealand's Privacy Act 2020, $10,000 maximum, and only for procedural failures such as non-notification, no financial consequence for failing to adequately protect data in the first place. On the 8th of October 2025, the Federal Court of Australia ordered Australian clinical labs to pay AUD 5.8 million for the MedLab pathology data breach, 4.2 million for failing to protect patient data, 800,000 for failing to investigate promptly, 800,000 for failing to notify affected individuals in time. It was the first civil penalty under the Australian Privacy Act in its history. The court's reasoning is the preview every New Zealand director should study. Australian clinical labs had outsourced its cybersecurity to a managed service provider. There was no multi-factor authentication for staff accessing patient data. Security monitoring was limited. Incident response planning was inadequate. Here is what the federal court said about all of that. Outsourcing did not discharge the duty. Having a managed service provider did not constitute reasonable steps. The board's reliance on vendor arrangements, rather than substantive oversight, was a governance failure, not an excuse for one. Simpson-Grierson, in its analysis of the judgment, framed it directly as a warning for New Zealand boards. Under the proposed penalty regime, the ACL framework provides the template for what judicial scrutiny of reasonable steps looks like. The deterrence gap between New Zealand and Australia is currently $10,000 against $5.8 million. The action plan has set the Ministry of Justice a mandate to close it. Zealand's once-only framework for government service delivery is built on a specific architectural premise. Citizens provide information once, and multiple agencies access that verified data through federated registries. Efficiency gained, administrative redundancy eliminated. Lack architectural efficiency creates systemic vulnerability. When a single registry contains falsified data, the error propagates across every downstream system that trusts it. The efficiency of data sharing becomes the velocity of error distribution. MediMap was not a government registry, but it demonstrated exactly the same dynamic. When the attacker falsified patient records, those changes propagated through the platform to every aged care facility relying on it. The correction required taking the entire platform offline. That is not a software outage, that is a once-only failure. 3 governance mechanisms address this vulnerability directly. The correction loop is an architectural pattern providing real-time verification, quarantine capabilities, and rapid remediation pathways. It operates through continuous provenance verification, using cryptographic audit trails, anomaly detection at registry boundaries that flags improbable modifications before they propagate, automated quarantine protocols, and upstream feedback mechanisms. MediMap lacked every one of these. By the time the anomalies became visible through human observation, they had propagated platform-wide. One critical point for directors: your defenses are typically only as strong as the least equipped partner feeding data through your federated connections. The correction loop is not purely an internal tool. It is protection against upstream governance failures you cannot control. Shadow OP to govern transparency addresses the informal data sharing arrangements that exist in every organization alongside formal frameworks. The goal is not eliminating informal sharing. Rigid process requirements tend to drive arrangements underground. The goal is ensuring all sharing, formal and informal, includes minimum governance controls. The kill switch is the capability that containment falls back on when the correction loop is insufficient. The actual ability to segment data registries and halt propagation of compromised data before it contaminates the broader ecosystem. Not a metaphor, not a documented procedure, a tested functional technical capability. MediMap's decision to take its platform offline was effectively a kill switch activation. But it was unplanned, total and sustained for 6 days. A properly designed kill switch enables targeted disconnection of compromised segments while maintaining continuity for unaffected services. The board-level question is not whether management has documentation about these capabilities. It is whether the capabilities have been tested in conditions that approximate a real attack. Six specific actions translate this framework into practice. Read the strategy, not a summary, the document itself, and the action plan. A director who has not engaged with New Zealand's cybersecurity strategy 2026 to 2030 cannot credibly demonstrate engagement with cyber risk under Section 137 of the Companies Act, 1993. The strategy is 15 pages. The action plan is a further document with specific work streams and timelines. Read both. Commission a board-level once-only audit. Ask management to map every federated data connection your organization maintains, formal and informal. For each connection, which external registries do you consume? Which downstream consumers receive data from your systems? And what shadow arrangements exist outside formal agreements? You cannot govern what you have not met. Test the kill switch, not review the documentation. Test the capability. Can your organization disconnect a compromised data source without taking the entire platform offline? When was it last tested under conditions that approximate a real attack? If management cannot answer with specificity, the capability does not exist in any operationally useful sense. Review vendor security arrangements. The ACL judgment established that outsourcing does not discharge the duty to take reasonable steps. Review the specific verifiable security capabilities of every third party holding data on your behalf, their MFA requirements for staff, their anomaly detection capabilities, their incident response plans, and tested response times. Contractual indemnities are not the same as verified technical capability. Mandate MFA. Both Manage My Health and MediMap were compromised through credential-based access. Neither had multi-factor authentication as a confirmed mandatory control. MFA is not a sophisticated measure. It is a baseline that the ACL judgment specifically identifies as part of what reasonable steps requires. If your critical platforms do not mandate MFA for all users, the correction loop and kill switch conversation is starting from behind. Document the governance response. A board that reads the strategy, commissions the once-only audit, reviews vendor arrangements, tests the kill switch, and mandates MFA, has a documented record of substantive engagement. That record is the difference between demonstrating reasonable steps and explaining why no steps were taken. The window is still open. The question is whether your board will act while it is. If you are a director or board advisor who needs to understand cyber risk without the jargon, subscribe to the Hamberger Report. New videos every day. That is the Hamberger Report for today. If this was useful, subscribe and hit the like button. It helps more professionals find the channel. You will find links to everything we covered in the description below. I am Andreas Hamberger, and I will see you tomorrow.